Hey, it's Dr. Matt, physical therapist. Can you reverse spinal stenosis without surgery? Today, we're going to cover the good news and the bad news. Here we go. Okay, so in today's video, we're talking about degenerative spinal stenosis. That's very important. Conditions such as osteoarthritis, bone spurs, degenerative disc disease, spondylolisthesis, when one vertebrae slips forward on the other, these types of things, scoliosis, degenerative spinal stenosis conditions. Okay. Please help me out, support my videos, give me a like, and subscribe to my channel. Also, if you want your free Beat Back Pain Blueprint, a 26-page guide to start addressing your back pain at home, check out the link in the comments. Let's go. So let's cover the bad news first. In cases of degenerative spinal stenosis, there's not going to be a conservative treatment or a passive treatment that is going to reverse the degenerative changes that have occurred in your spine. Okay. If you're developing bone spurs around the spinal canal, there's no conservative treatment. There's no exercise. There's nothing they're going to do, anyone can do to make those bone spurs disappear without surgery. Okay. In the case of, say, a degenerative disc disease, if there's breakdown of the spaces between the vertebrae, I mean, yes, you can do some passive traction to create some space there temporarily, but if there's been significant degeneration of the disc, if the disc has dried up due to just age and wear and tear, there's not going to be a conservative treatment or an exercise that's going to make that disc come back. Okay. In the case of a spondylolisthesis or some sort of a fracture in here, if you can see that, this vertebrae would slip forward on the vertebrae below it. Okay. There's no exercise that's going to put that vertebrae back in place. Yes, you can do exercise and core strengthening, which I'm a huge fan of, to control it and to keep it in check. But to do an exercise that's going to put that vertebrae all the way back in place, not likely. I guess it's possible, but I haven't seen it. If there's breakdown of the facet joints, all these joints in your spine, there's no passive treatment, no conservative treatment, no exercise that's going to build those joints back up again. Okay. So that's the bad news. Let's cover the good news. Okay. So here's the good news. It is absolutely worth it to use an intelligent strength and mobility program to try to manage your spinal stenosis. Your vertebrae in your spine are meant to be in a certain alignment. Okay, they want to be stacked up nicely, one on top of the other. With degenerative changes, it alters the way these vertebrae sit on one another, and it creates abnormal forces through the spine, and it creates a faster degenerative process. Basically, things break down quicker. So with postural training, with core stability training, you can improve the alignment of your spine, and that's going to help slow down that degenerative process. It's my opinion that you're going to slow down that degenerative process. Whereas if you do nothing, that alignment of your spine is just going to get worse and worse. And the deterioration is just going to get worse and worse. I've seen people really benefit from strength and mobility program. It actually can reduce their symptoms. It can improve their quality of life. It doesn't make things go away completely. It's not a magic trick, but you can have a good life. You can have spinal stenosis and you can manage your symptoms. And in many cases, you can avoid surgery and live a good life. Do everything you can to avoid surgery. And then, unfortunately, some people do need surgery. If you do need surgery, you still want to do strength and mobility training before and after, because if you don't make any changes and you have surgery, that breakdown process that was occurring, it's going to happen again. Okay. You're going to have breakdown above and below the areas of your spine that were fused, and you're going to run into the same issues all over again. So there's no way around it. Strength and mobility training, absolutely worth it. Improve the quality of your life. I hope this video was helpful for you. I hope it gave you a little bit of hope. Please subscribe. Please send me your comments, and I'll see you again soon.